Hi everyone, Dr. Byrne at Revive TV. On this week's episode, we're going to discuss the causes of your lower back pain and the 3 things you must do to avoid it coming back again. Okay, so last week we discussed the conditions and the causes of your lower back pain. We're going to talk about those briefly again before we get into the 3 strategies, or the 3 things you must do to avoid it coming back again. At the end of the video, we're going to share with you a free link, a download that is going to give you some strategies to help you deal, if you've got lower back pain, help you deal with it in the current circumstances, or if you've had it in the past and you're trying to avoid it coming back again, some really great strategies to help you in your day-to-day life to make sure that it doesn't come back, or at least decreases the likelihood. So watch to the end and we will share that link with you. So last week, we started by discussing the conditions. These are the type of things that people come to our practice with. For example, we would see 75% of the people we see would have some form of lower back pain, whether that's a muscle sprain or ligament sprain, whether it's a disc bulge or a herniation of some sort, whether there's some form of arthritis or a spinal or postural distortion. These are the kind of the conditions, the majority of conditions that people come to our practice with. But what we said was there were causes underlying these conditions, and there were 5 causes. And the first one we discussed was trauma. So trauma could come in the form of a sporting accident or a fall, something of this nature, where there is an impact to your body. The second one we discussed was lifting or improper lifting, whether that's lifting inappropriately because the weight was too much, or we tried to lift something that was heavy but got poor technique. Or through repetition. And we said that most of the people we see that have injury from lifting is usually through a repetition, something they do on a daily basis, but they perhaps have poor technique, and then over time there's this accumulation that occurs. The third one was excess weight, and we said that 2/3 of the Australian population are considered overweight or obese, and so fall into a category where they increase their likelihood of potential lower back pain if they haven't had it already because of that weight. It changes the center of gravity, which means it changes the way where our pelvis sits and how hard our little muscles and our joints have to work. They have to work differently. And the last 2 were more closer to my heart, because it's what we kind of see and deal with on a regular basis, and that is postural changes. Not just things like scoliosis, but just things like where your hips are. Is one hip higher than the other? Is your pelvis tilted too far forward or too far back? Even if you have this forward head posture, which is very common now because of the devices we use, we know that as soon as we take ourselves into this forward head posture, that it flattens out our lower back a little. So if we're in that position for a long time, what kind of effect is it having? And then there's segmental distortion, so joint to joint. How well they're moving. We know that if they're not moving as they're intended, it starts the little messages that go to the muscles either side are affected, and therefore it is much more challenging to hold ourselves in the position that we want to. So let's now discuss the 3 things we must do to avoid our lower back pain from occurring or reoccurring, for that matter. So the first one that I believe is crucial is to build strength. And the best way I know to build strength is through functional movement. Before I talk about the functional movement, I want to talk about what different types of strength. So we need strength in the muscles that do action. So for example, our glutes are doing muscles, so we need them to activate and we need them to have strength. Our chest muscles are doing muscles. They help us move. And then there's the other ones, so they're doing muscles or action muscles. And then there's postural muscles, the ones that kind of stabilize us so we don't overshoot a movement. That allow us to keep the spine in the position, or keep our shoulder in the position, or our knees in the position they need to be when they're performing an action. So there's stabilizers and doing muscles. The best way I know to strengthen both of those muscles is through functional movement. And the functional movement I've chosen to do is a class. I choose to do CrossFit. There are many different types of functional movement classes, and you can do them in the gym yourself without doing a class. Personally, I find it, for me, the best way because I have someone there to instruct me, someone there to watch me to make sure my technique is good. So building up strength through functional movement, that things like doing squats or doing push-ups and pull-ups, doing a rope climb, doing lunges, these type of actions are functional movements. They incorporating more than one muscle. They're usually incorporating more than one joint. Usually 2 to 3 joints are being worked, and they're asking not only the action muscles to work, but they're asking the postural muscles to activate as well. So that's the first thing that I would do. So if I was recommending to do something to build strength, for me, it would be to join a functional movement class, whether that's CrossFit, I know there's F45 and a whole host of other ones that you could choose. So build strength, it's a must. The second, which ties in really to the first one, is to move regularly. So if you're doing these exercises and stuff like that, that is, it's going to help with your movement as well. It's going to part of this, but not just doing a class once or twice a week or 3 times a week for an hour doesn't really offset the amount we sit. So most of us, not all of us, lead fairly sedentary lives where sitting in an office or sitting in a chair for long periods of time. We might get home and sit on the couch, or we might drive for an hour to and from work or on a train. So oftentimes we're doing a lot of sitting, and doing those classes and doing exercise for an hour a day, but if you're sitting 12-hour days, it doesn't cut it in terms of the requirements to have a healthy spine. So you need to move regularly. One of the things we've talked about is that the little muscles, the postural muscles that hold up our spine, they like to work just as much as any doing muscle does. So when we sit, these muscles aren't asked to work as they want to work. So one of the things we must do is get up and move regularly. And I'm suggesting you should be moving every 30 minutes. What I'll be doing is I'll be getting a timer on my phone. There's lots of different apps that you could use to get up and move. But movement is essential to help the postural muscles on either side of your spine to remain active. The longer we sit, the less active they become, and we do that repetitively over time. You will start to feel the effects, because what will happen is the muscles around that, the bigger muscles, the doing muscles, will start to not only do the work, they will start to try and stabilize you as well. Have you ever felt a little bit tight in your lower back and your muscles felt tight, but they also felt tired and sore as well? Well, that's the reason. These little muscles either side of the spine aren't doing their job, and you're asking these bigger, broader muscles to do that for you. And the third and final thing you must do to avoid lower back pain is get your posture and your spinal distortions checked by a health expert, whether that's through a chiropractor, through an osteopath, a physiotherapist, or other body workers. It's essential to make sure that we have good posture. We've already talked about that one of the causes of lower back pain is these postural distortions. And we've also talked about how these segmental distortions can affect those little paraspinal muscles from being activated and working as they're intended to. So the third thing I do is make sure I get my posture checked. So in our office, for example, we take images and line up different points to see how your posture is, both from the front and from the side. And then we'll palpate your spine to feel where we think there might be some potential distortions. And other practitioners will do similar things as that when assessing your spine. So the 3 things you must do is build some strength, start moving, and have your posture assessed by a health professional. I said to you at the start there would be a download. So I've got a checklist, a 10-point checklist that you can work through. So if you just click the link below, it'll take you to that checklist, and you can work through and see some of the things you can do to start to prevent your lower back pain or move towards getting out of your back pain. I also mentioned there's an event. It's called Inspired Movement. It's on Tuesday, the 27th of March at 7 p.m. at the practice at Revive Chiropractic. It's on our Facebook page. The event's there. You can register. There. Movement, as we've discussed with lower back pain, is essential, and we're going to discuss the 4 requirements of movement that your body needs to be optimal. So please come along with that. Bring a guest, and we'd love to see you there. So go and download the checklist, subscribe to the event, and make sure that you're starting to move more, build strength, and get your posture assessed. Thanks for watching this week's episode. I'll see you next week. We're right there.